Going to get started. I'm going to minimize this here for a minute. All right, good. We are recording and we're ready to roll. All right, so my name is Cheryl Hawksley. I'm a family nurse practitioner student at Rivier University. And today I'm going to talk a little bit about telehealth. And it doesn't look like I have any participants just yet, but we're going to record this session so people can view it at a later time. Yeah, so this is my presentation on telehealth. Telehealth, what do you need to know, what to expect, and how do you prepare for your telehealth visit? And let's just bring this up like this. Good. All right. So I want to start a little bit by talking about what telehealth or telemedicine is and why it's so important. And for the purpose of this presentation, I'm going to kind of use telehealth and telemedicine interchangeably. And on the screen here, we can see a couple of different definitions, one from the American Academy of Family Physicians, one from the World Health Organization, one from the Centers for Disease Control. And I'd like to think if we could take bits and pieces from each one of these definitions and kind of put them together, then we can get a pretty well-rounded definition of just what telehealth or telemedicine is. So on this slide here, this is what I think is a pretty well-rounded definition of what telehealth or telemedicine is. And I'm just going to read it. It says telehealth, it's the use of telecommunication technology, whether it's telephonic or video media, between a provider and a patient who are at different locations for the purpose of providing a wide range of healthcare services, including but not limited to evaluation of acute illnesses, management of chronic disease, mental health counseling, nutrition counseling, specialty consultations, prescription drug management, as well as reviewing laboratory or diagnostic test results. And most importantly, it allows the opportunity for questioning and for discussion between a patient and a provider. So to back up a little bit and kind of talk about the history or the evolution of telehealth and telemedicine, they are not new technologies. They've been around for a long time and used in the treatment and management of patients. And I know for me, working in the hospital setting, I work at a community hospital, and for at least a handful of years now, we've participated in a program called the Electronic Intensive Care Unit, which is an offsite location where there are intensivists and critical care nurses that can video in. They have access to all of our computer records so that if there's something emergent going on in an off shift, they can certainly be of support to us there. So it's not a new technology. And with this picture here, I think this picture is really great because it kind of shows us just how long telehealth has been around in one capacity of another. This photo is actually a magazine cover from 1925. The magazine title up top here is Science and Invention. And this picture is showing us a provider or a doctor diagnosing a patient by radio. And he has this Envision device in the circle here that kind of shows us a video examination that he would be doing of a patient over a distance or at a separate location. So certainly telehealth has come a long way since this envisionment in this magazine cover. But it's certainly a rapidly growing part of our healthcare system as technologies have advanced. And as we, as a nation, have really wanted to increase access to care, improve the quality of care, and decrease some of the health disparities that we see across our nation. So why are you just hearing about this telehealth now, or why are you having to utilize telehealth now? Well, let's see. So as I mentioned on the previous screen, telemedicine has been around for a long time, often in more rural locations. But the guideline requirements and the financial reimbursements that are regulated by the Centers for Medicare and Medicaid Services have kind of limited its widespread use up until now. As we all know, in this past January, with the outbreak of the coronavirus, also referred to as COVID-19, this virus quickly became a public health safety concern. So like in January 20th, we had the first case of COVID-19 here in the United States. And, just 11 days later, by January 31st, the virus had become so widespread that it was declared a public health emergency. And come March, the World Health Organization had officially declared COVID-19 a pandemic. The Department of Health and Human Services have declared COVID-19 just a public health emergency. So, even though telehealth has been around for a long time and there are many reasons for its increased use, the, COVID-19 pandemic and the concern for national public safety has certainly kind of fast-tracked telemedicine at almost an instantaneous and widespread rate. So that's really one reason why we're seeing so much of it now. So telemedicine in New Hampshire and federal adaptation of telehealth. So here in New Hampshire at the state level, Governor Chris Sununu has passed a House Bill 1623, which kind of amends the state's definition of telemedicine. It expands it to include new modalities, including audio or telephonic modalities. And it requires Medicaid and private payers to reimburse for telehealth services at the same rate as in-person visits. It expands the list of providers that are able to use telehealth, and it kind of eliminates some of the previous restrictions on different sites for telehealth services. So once again, allowing that adaptation to more widespread use. And at the federal level, President Trump, since he declared this, emergency, the Centers for Medicare and Medicaid Services have also expanded telehealth coverage, and they've done that under a waiver called Waiver 1135. So let's talk a little bit about some of the potential benefits and some of the potential disadvantages that we can see with telehealth or telemedicine. So some of the benefits are that telemedicine allows you to stay in the comfort of your own home, which certainly decreases your risk for exposure to infection or viruses, and not even the coronavirus that we've been talking so much about, but also as we're starting into flu season, the flu virus. It's been shown to reduce wait times for services. It reduces the number of visits to the clinic. It certainly saves on travel time and cost of transportation or travel. It allows you to talk to your provider live, like we're kind of doing right now, via video or via the telephone. And it allows you to send messages through patient portals and different things where you can ask questions and kind of communicate back and forth. So what are some of the potential or possible disadvantages? So probably one of the biggest ones is that it requires people to have smartphones or tablets or laptops or computers, and to know how to use that technology. And then sometimes hearing can be, an issue with some of these technologies. I know in some of the articles and some of the research that I was doing, it talked about having these services available at different community health centers and senior centers, so that for those people that don't have the availability at home, they can go into their senior center, go into their community center, and to participate in these services there. And I just thought that was amazing. I thought that was absolutely a wonderful technology that could come about. And then some of the other disadvantages, technological glitches, because this kind of came about so quickly, it's still a developing platform, all of these different, Zooms and UpDocs and all of these different services. So we're still kind of developing that. There can be a limited physical exam depending upon what the visit is for. And then there's always that concern that people have over privacy with their personal medical information. So what to expect? So telehealth visits, you're going to expect a lot of what you expect in an in-office visit, very similar. So you're going to expect your provider to introduce themselves, kind of like I introduced myself in starting this presentation today. You're going to expect them to be in a quiet, private, well-lit location where conversations one-on-one can occur. Expect the provider to have looked at your records, kind of like we do before an in-office visit. and expect them to ask you questions about what this visit is about, whether it's an acute visit or a chronic disease management visit, or if it's to adjust your medications or see how you're doing, and to ask about any of those questions or concerns that you have. If it is for an acute visit, if you have a rash or if you have a sore throat, kind of expect the provider to say, can you hold that area up to the screen and show me that rash? Or can you open up your mouth and kind of move closer to the screen so I can take a look? Just like when you're an in-office visit, the provider may order diagnostic testing or lab work for you to go have at the lab. They may send prescriptions electronically to your pharmacy. They may recommend that, yes, we do need to see you in the office for an in-office visit. They may give you a referral, whether it's to a nutritionist or something else, or they may want to follow up again with another telehealth visit. But most definitely, like you would at any in-office visit, kind of expect to have a clear plan of care and follow-up plan with what the next step in your plan of care is. So how do you prepare for your telehealth visit? So let's start with number one. Once you make the appointment for your telehealth visit, kind of look around and make the decision of where you're going to have this video chat or have this telephone conversation. Once again, you want to make sure that it's in a quiet location that's private, where they can hear you and you can hear them. That's well lit, where they can see you and you can see them. Where you feel comfortable discussing your personal medical history, them asking you questions, you asking them questions, or once again, if you need to kind of show them an area where there's a rash or a sore throat or something like that, where you're comfortable doing that. Also, if you have any home monitoring devices that you use at home, whether it's a blood pressure cuff or a pulse oximeter or a glucometer, have them wherever you've decided to do your visit, have them handy next to you so that if the physician wants you to take your blood pressure or check your pulse oximeter, that's certainly something you can do while you're participating in the visit. It's also a good idea to arrive 10 to 15 minutes early because there are always technological glitches that arise here and there. And remember not to be nervous. If your meeting is scheduled for 11 o'clock and 11 o'clock comes and the provider hasn't logged in yet, don't think right away that maybe there's something wrong with your technology. Sometimes kind of just like when you're in an in-office visit, providers are seeing other patients, they can be running a couple of minutes behind. Just kind of take a deep breath and hold tight, and they will be with you. And remember at the end of the day, if something goes wrong technologically, you can call and speak with the provider via a telephone visit, or you can call the office and schedule for an in-office visit. Certainly we will make that work. So number two, eliminate distractions, background noise, TV, radio, any message alerts that kind of bing, bing, and pop up on your phone. Kind of turn them all off and put them aside so that you can really focus on your visit. If you are meeting with a provider that you have never met with before, absolutely it's okay to say, who am I speaking with? Can I see your badge? So that you have an idea of who it is that you're speaking with for your visit. It's always a good idea to start the visit by confirming, well, my understanding is that this visit is for blank, so that right off the bat, and that your provider can kind of schedule time around any questions or concerns that you have, what the visit is for, and what you would like to talk about. Which brings me to number 5, make a list. If you have any questions, have that list ready to go prior to your visit so that you don't forget what it is that you want to talk about during your visit. Which brings us to number 6, pen and paper. Have a pen and paper handy. Sometimes new questions arise or you're given instructions that you don't want to forget. So it's important to write them down while you're having that telehealth visit. So having that pen and paper handy with you will just kind of allow you to do that. Number 7, if you wear glasses, if you have hearing assist devices or hearing aids, either have them on or, once again, with everything else, have them right next to you so that if you need them, you have them readily available. And then kind of going back to something I already touched base on, have a clear understanding of the planning, care, and follow-up. So before you end that visit, just say, okay, well, when am I following up? What's the plan? You have that pen and paper right there. You can write it down so that later you can take a look at it and say, oh, yeah, this was the plan. And once again, just plan for technological hiccups. They certainly happen. And not to worry, we can always switch a video visit to a telephone visit. And if we need to make an appointment in the office, we can certainly do that as well. So I'm a big fan of checklists. I had sent a copy of this with a copy of my presentation. So hopefully they'll be able to print them out and they'll be available for anyone that would like them. And it's just a quick little everything we discussed on the previous screen that you kind of check off as you go along, as you get ready for your telehealth visit. Is this a good spot for my visit? Yep. Confirm who I'm talking to. Yep. What's the reason for my visit? Do I have my medications and allergies? Do I have my blood pressure cuff? Do I have a pen and paper? Yep. And you can kind of check everything off as you go along. Plus it gives you extra paper if you have any extra added questions or anything like that. So kind of just in closing, telemedicine, it is a cost-effective modality that certainly has improved the accessibility and the quality of our healthcare system. It is fairly easy to use, even though it doesn't seem like it at first, but it's one of those modalities that the more you use it, the more familiar you become with it, the easier it becomes every time. It's certainly an adjunct to our healthcare system, and I really think it's one that's here to stay in numerous capacities. And it really has been shown to kind of reduce that risk of infection or that spread of, the coronavirus and certainly the flu virus once again as we start into the flu season. So this is the last screen of my presentation. I hope you found it helpful. I hope it helps you get ready for your telehealth or telemedicine visit. I hope you're able to get the checklist and that you use it and that it's helpful. And thank you for watching. This last screen here kind of just lists my references that I had for the presentation. And certainly if anybody has any questions or let's see who we have here. All right, well, I don't see anybody just yet, but that kind of concludes my presentation. And once again, I hope everybody enjoyed it. And that's it.
Right. You can go ahead.